according to the cloud. So
Perfect.
as we've talked about, this is the Business Entrepreneur and Private Practice Student Interest Group. And I'm here to introduce our esteemed guest, Jarod Carter. Take it away.
Am I just digging right in?
Alumni as well.
And alumni,
Yeah,
yes.
man. Yeah. So I guess
Expert of cash pay.
here's the thing, right? There were two questions asked amongst all of the chapters.
Okay.
The number one most important question was, how do I get into cash pay? What do I need to know about it? And the second one was, what insurances should I take and how do I go about that? So we're going to leave that off for another discussion. The big one, the A number one question for
I could
you
speak to the
tonight.
second one too.
Yeah, yeah. Well, I know.
But go ahead. Yeah.
Let's start with this, Jared. You went to St. Augustine, right? When did you graduate?
2005.
Okay. All right. And so you're local here to the Austin area, which is awesome. Tell us a little bit about why cash pay. Let's start there. What was the why for you?
You know, I think that most of us get into physical therapy, at least one of our primary reasons being that we want to help people. And even back then in 2010, when I started my practice, you know, it was about 5 years after I graduated, I could see already the writing on the wall. I had the luxury of working at a pretty solid insurance-based practice. We weren't, you know, already seeing 5 patients an hour, but there were some already back then doing that. And all, you know, you hear from, you know, practice owners and colleagues is just, you know, these declining reimbursements and on and on. And I was already hearing that in PT school. You know, there was always this grumbling, but no one was really doing anything about it in terms of breaking out of that model. Not no one, but very, very few. And so when I got to the point where I knew I wanted to start my own practice, I knew that long term, the only sustainable path forward, mathematically, not this is what I want, blah, 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 but the only sustainable mathematical path forward and the only way that I was going to be able to fulfill my mission of why I got into physical therapy, which is to help people at the highest level, those two things come together in the cash pay practice model, in my opinion. Um, and it's one of those things where, I mean, I coach a lot of different practice owners, some fully insurance based and wanting to go kind of to the hybrid model, just drop low paying contracts. And then some that, you know, are starting from scratch and want to go straight into cash pay, you know, everything in between. And it's not that I think everyone should be 100% cash based or out of network. I don't think that. In some markets, there are still payers that you can make a solid, I mean, for those that don't really price their services well and they're only making, you know, cash pay like 30-40 bucks profit per patient, like there's a lot of insurance based payer, you know, practices that have payers that beat that. So I'm not saying no to insurance across the board. I'm just saying don't contribute to this epidemic problem of
Yeah.
accepting insurances that are only going to pay you enough to where you're making $5 or $10 a patient. You know, I mean, you could make more with an eBay store out of your garage. Like there's 17-year-olds kicking your ass
Yep.
if that's what you're willing to accept after you've gone through all of what y'all are going through. Poor bastards right now. I remember that. It was a long time ago, but God, it was hard. And I think before we got on, I was, as I was like putting on my collared shirt, I heard y'all talking about a bunch of y'all's colleagues can't be here because of finals. And I was like, oh God. I remember those days. You go through all that and you come out, you know, not just saddled with debt, but you know, you come out and you eventually it's at some point you start your practice and you start saying yes to making $5 an hour. Are you kidding me? Because that is the reality of a lot of markets with and a lot of insurances, but not all of them. And
Right.
so what I would say is, you know, when I answer why cash pay, it's more of just it's not necessarily why cash pay, it's just why make good mathematical business decisions that support your ability to provide a level of care that you can be proud of and that you got into this career for the first, you know, in the first place
Yeah.
to do, right? So that's why. That's in a nutshell. That's why.
Yeah, I mean, I think you sum it up real well. It's a straight up business decision. It's not emotional. It's not what you want to do. It's the mathematics behind it, right? And like you said, it's different state to state. It's different payer to payer. I've seen Blue Cross Blue Shield out in like Seattle, Washington offer 150, $200, reimbursement per visit. I've seen it in New Jersey offer 25, $30 per visit. Same insurance, same plan, different state, right? I mean, that's insane. And like
Yeah.
you said, you've got to be able to navigate through that and say no to the crummy contracts and yes to the ones that do make sense, but then cash pay where you feel it's necessary. So
And
walk us through like the basics of
can I
what
just
a
add real
cash pay
quick?
model. Yeah, please.
Just on that, if we want to dig in a little, I want you guys to really, take as much from this as possible, and it not to just be total kind of overarching surface level stuff that you probably already have heard on podcasts and stuff. And when you're looking and you're analyzing, when you go into private practice, if you're looking at, let's see what kind of payers are out there, and maybe some of them are going to offer that which makes sense mathematically. There's another factor outside of just what they're willing to pay on a per patient basis, or on an average, if they're not just a capitated rate, meaning like a flat rate for all patients, but rather they will pay different amounts for different codes depending on what you provide, right? But either way, you get that range. It's not just about that dollar amount. And let's say you're like, okay, I take Blue Cross in my market, and I'm actually going to make $120 on average per patient, for an hour with a patient, an hour worth of codes. Well, and then you've calculated, okay, maybe you're just starting out and you kind of do a little market research and you figure that you can probably see a patient at your own cost at $60 to $70 an hour, right? Now that sounds like a nice delta, 50-ish, 50 or so dollars, 40, $50. Um, but what other administrative burden do they put on you that is going to make it not just costly to collect that 40 or $50 profit, but is a freaking headache that's going to just, make this more of a job than a lifestyle kind of business, right? So, I that came up with me because literally right now I have two coaching clients at private practices in the Seattle area, and there's a big payer there called Regents, and Regents and Blue Cross are basically like in bed together in that market. And so it's like Blue Cross processes Regents stuff. It gets kind of complicated, but at any rate, they pay really, really well on an out of network basis and an in network basis. But their administrative burden and the prior auths that they require. It's like, to get started with a patient, you're doing all this paperwork after the eval, which usually delays when they can come in for the second visit. And then they'll give you like 4, maybe 6 visits before you got to do the whole damn thing over again, or your staff does, right? You're paying your staff for that time. You're paying your admins to chase them down, make sure they got it. Oh no, you didn't dot this I, cross this T. And so, like, even though they're a fantastic payer on paper, both of those of my coaching clients are like, I don't care if we make $50 a visit. It's not worth the headache. And ultimately, when I really add in like the additional administrative costs to get that $50 a visit, it's not $50. I'm down to 15 again. I'm competing with 17-year-old eBay guy, right? So that's where you want to not just look at the numbers there, but also like the overall administrative burden and headaches that go into collecting. Some payers they don't have prior auths and they pay well, and I say go for it, but know that they're only going to do what they've all done over time, and it's not always going to be as good. So if they're on the edge, it's like, okay, I'll take 35 a visit profit, no prior auths, okay. Just know that in a few years, as they're renegotiating with you every time, you just need to know, like, I'm probably going to have to drop this. And if you're starting out and you build a pretty solid business that is predominantly insurance based, it's a whole lot harder to drop insurances when your established clientele expects you to take their insurance than it is to start out predominantly cash pay or fully cash pay.
Yeah.
Just word to the wise. Like, if it's on the margin and edge, know that probably in a few years you're going to be in that decision making point already.
Yeah.
So yeah, so I just wanted to get a little more nitty gritty and detailed for you
No,
guys.
for sure. And I think that's huge because, again, it's setting expectations, right? If you run a high level cash pay business right out of the gate, that's what your clients are mostly going to be used to. So if
Yeah.
you do have to drop one or two insurances here or there, it's not a huge loss because either you kind of prepped them and got them ready for that anyway, or, you know, they were right on the borderline anyway. And like you said, you were going to probably have to drop them soon eventually anyway, right? So, again, these are some like fine, minute type details that matter, right? Especially when you're making CEO level, business level decisions, right?
Right.
I mean, that's why when I first started, I was cash pay, out of network, out of pocket, 100% mobile therapy. I only saw people that were in the like 40 to 60 range, and they were all CEOs, C-suite level execs, and businessmen and businesswomen. That was it. I just didn't want the headaches because I was everything, right? I was the towel guy. I was the front desk. I was the biller. I did it all, right? So like, I wanted to make it as easy on me as possible as I grew, and eventually I just didn't want to deal with insurances, right? So I said, here's my services, here's my value. And I was really selling them time, right? And
Right.
convenience. It wasn't really
Being
physical
mobile.
therapy. By coming to their home, by coming to their office, by coming to their gym, I was selling them convenience, and they loved that, right? So they were more than willing to pay for the convenience of the concierge type mobile service. Now, in hindsight, I really wished I had done a brick and mortar and that I had a, a real estate play to back that up, but that's a whole nother story. Um,
Yeah.
so let's talk now about the cash pay model, right? Let's just, walk us through what a true cash pay model kind of looks like.
Would you like kind of the blueprint that I generally teach for creating one?
Sure. Yeah, sure.
Yeah, so I think a lot of people kind of start with they start with, how do I get the phone ringing? How do I get people interested? And then how do I learn how to sell them on going out of network when they could, pay a lot less for physical therapy just down the road? And then, what do I deliver? Right. And then finally, after that, the logistics of like scaling the business and all that kind of stuff. And in a way, I kind of like to reverse engineer it. I like to start with the service and the experience first. So before you try to get the phone ringing and try to figure out how to get someone to say yes to an out of network offer, you got to make sure that you have crafted an experience and something that's going to lead to the results that they're, that people would be totally happy to pay more out of pocket for than going down the street for physical therapy, right? And I'll tell you right now, like for those who are interested, it sounded like you guys did a poll of the special instance group across all of your 5 campuses, and they were, one of the primary thing that was asked about was cash-based therapy, which is really common nowadays. But there's the result of that is that everyone's interested in it because insurance is just getting harder and harder to deal with, harder and harder to be profitable from. And so everyone's interested in it. And in every market, pretty much that I know of, there's been an explosion of competition that is also cash pay. And so back in 2010, when I started my practice, I was able to really differentiate myself enough to have a full schedule of patients and my staff be full by basically saying, look, if you want to pull on stretch cords and do the same thing that you could do at home or in the gym, and you want 15 minutes of time with your provider, you can go use your insurance. We spend an hour one-on-one with every patient. We will, work with you to do all the things that you need to do in terms of exercises and stretches in the clinic, but predominantly we're going to be teaching you how to do that on your own time. The stuff that you can do on your own time, right? That was enough of a differentiation to be pretty full with a few providers in the cash pay model. It's not anymore. You can't just go out and say, I spend an hour with every patient and expect that to be enough. And so when I'm talking about that first kind of column of this process or this blueprint, and I call it the VOP care experience. So it's the value centric, outcome focused, and personalized experience. And there's so many different things that you can add in for each of those kind of categories that go way beyond I spend an hour one-on-one with you, or hey, I have a doctorate. Like, that was another thing. Like back when I graduated, I mean, I think 25% of programs were doctoral granting programs. Now, of course, 100% are. So a lot of the things that used to be enough, they're not enough anymore. So you really have to create an experience that is going to absolutely wow people. And
Yeah, the Disney experience of
yeah,
physical
it's got
therapy,
to be
right?
really, really impressive,
Yeah.
right?
Yeah.
And then now that you have an experience that it goes above and beyond even all your cash pay competition as much as you can, right? Which also includes being able to provide a badass result and being an incredible therapist, right? And we can probably circle back to that later because I know there'll be a question about, can I do this straight out of school? Um, but then you got to be able to convey the value of that experience to someone who's not experienced it yet. And that's where the skill set of the initial phone call and initial consultations and being able to sell yourself. And sorry if that makes anyone feel icky or weird inside, but you have to be able to sell your services, right? And remember, we are selling to serve, right? If you don't convince this person to say yes to your services that are going to get them the best possible experience and the best possible result, then they either don't get care or they get care somewhere else and they don't get as good a result. And you've done them a disservice, right? And if you really are that good and your staff is that good, which you should be, you should make sure of that. That's where, you're literally doing people disservice and you're not living out your mission to help people at the highest level. And that's, again, I don't, for those who joined recently, I started out with saying like most of us started and got into this because we want to help people. Just remind yourself of that. If sales makes you feel icky, recognize that it is part of you living out your mission to serve people at the highest level. Because if they don't say yes to you, maybe they use their insurance somewhere else, they get shitty care at some physician-owned practice that really they were just sent there so that they could check the box with insurance so they could put them on the surgical table. 5 years later, they're on their fourth back surgery and they end up a total train wreck on your table, or someone else's table. And that could have been avoided. I mean, I use that analogy because I have literally seen it over and over in my clinic through the years. I'm like, God, I wish I could have gotten a hold of you when this was just a stiff back when you got out of bed in the morning.
Yeah.
Because your life would be so different. So we are selling to serve. And that second pillar of knowing how to sell your services to somebody who hasn't actually experienced them yet is kind of the second step in the blueprint. The third is now that you have this amazing service that's worth going out of network for and paying more for, you know how to sell them on it, or your staff that you've trained knows how to sell them on it. Now you got to get the phone ringing off the hook. That's where marketing and lead generation comes in. And there's a wide variety of ways to get qualified people, qualified leads picking up the phone or filling out a website inquiry or whatever the case, expressing their interest in your services. Right now, I'm literally in week 2 of a 4-week marketing intensive that's specifically about that. And there's basically 9 things that we've identified over helping hundreds of practices do this over time, or thousands now, that these are the things that really consistently work in the majority of cash pay practices, healthcare practices out there. We work with a lot way beyond just physical therapy. And these are like the things that are the common denominators. They just work, it's like you can totally skyrocket how many online reviews you get with certain tactics compared to if you just, let it happen organically. Same thing with word of mouth. Same thing with professional referrals, not just physician referrals, but any, non-patient word of mouth referrals. Then you've got, paid advertising. You've got email marketing is huge. You've got presentations and workshops. Then you got all the website stuff, not just SEO to get them there, but then the user interface and the conversion points on your website to get them to become leads and to pick up the phone in the moment, or to download a lead magnet if they're not there yet, or to fill out a web form if they're not quite ready to pick up the phone, but they want more than just a lead magnet, right? So there's all of these different things that can get your leads coming in. And then the fourth pillar is systematizing, automating where possible, and staffing out to scale your practice to whatever level that you want. And even if you want to be like a solo provider, a lot of people are like, I just want to keep it small and simple. I don't want to deal with employees. I can tell you from personal experience that if if you are the sole provider of that practice, right, and something happens to you or something happens to your family, you are in trouble. And Scott knows this, and maybe some of you also know, but I have 6-year-old twins with spinal muscular atrophy. And when they were diagnosed about 5.5 years ago, everything changed. And I had to go from like fairly full-time in the clinic to over time, I don't see patients now much at all, which I miss. So I still see a few here and there. But I've got great staff providing high-level services. I've got administrators doing all the other stuff. And, I take home a 6-figure income and I spend 3 hours a week on that business, 3 hours. And that was by necessity. So I can be close to my family. We run like a full-time therapy and medical home here. And so please don't go in, like, you can be a solo provider for a while, but as soon as you can, get some administrative help to get things off your plate, and at least have like a part-time great therapist to see some patients. And if the shit hits the fan and you need somebody to step up and keep your business afloat, like, they're there to do that. Please take my advice on that. So that last pillar is making sure that this thing runs smoothly because it's automated, it's systematized, your operating procedures are well defined, everyone's understanding of them, your missions, core value, all that stuff that you can use to scale your practice in without so much growing pains to whatever level you want. You can make it huge, you can keep it small, whatever you want, but you got to get those foundational pieces in place. Excuse me, knocking into my microphone here, in order to have a practice that is not just another job and a headache, right? But is a smooth running, cash flow badass, that in which you can see as many patients as you want or as few patients as you want. You can do what you want because you've designed it that way. So that's the blueprint and how I help, how I walk students or, my practice owner clients through the process.
It's crazy there, but you hit on a huge point, Jarod, and I think it's important to kind of realize this. Scaling, the whole point of scaling is actually to do less. It's to say no to more stuff and putting less on your plate
Yeah.
and leveraging other people to do the things to grow and scale so that you can work literally on the business, not in it.
Yeah.
And that's a common theme that we hear throughout a lot of these interviews, is that, well, I'm growing. And so I had to hire this person, then I had to hire this person. And that's what happened to me. I mean, I was, working full time at a sniff and part time home health and then part time doing my own thing. And I got so busy to where I literally was working 80 hours a week and it was too much. It wasn't sustainable. I had just created another job for myself. And I told my wife that we knew that. Then fortunately and unfortunately, COVID hit and it was a hard reset, and I had to kind of figure the next step out. But it really, it took a lot to realize that I couldn't keep doing this all by myself. Early on, yeah, you had to bootstrap, you had to do it all. But
Yeah.
eventually, you got to start bringing in the pieces to help you out and offload some of that stuff. So
Yeah.
I think that's a really great point and a good piece of advice for
You're
sure.
talking
I
about
would second
the
that.
entrepreneur library. There's one you might consider adding in there, and it's on this topic, and it's by a guy that he's one of the like biggest known business coaches in the world. His name's Dan Sullivan. I met him about a year ago, and he has a book called Who Not How, and it really is about that, like not getting I guess falling trap to the idea that you have to wear all the hats and do everything. And if you have an idea of something, whether it's a new business or a component of your business, a new service, whatever, it's not how am I going to do this? It's who am I going to get to help me do this?
Yeah.
Um,
1,000%.
there's more to it. I mean, that's a decent summary of the book, but you might throw it in there because there's more to it than that.
Yeah, well, and we're trying to grow the library year after year, so we'll just keep adding great recommendations because again, I hate when people come and say, "Well, hey, I need a book to read. What book should I read?" It's like, well, what problem do you have? What are we trying to solve? What are we trying to figure out? And if you tell me that, I can give you 2 or 3 books on each thing you need, right? And so having that whole arsenal of all these possibilities, all these books that are like 10 to 15 to 20 years of people's experience, all
Right.
written down into 200 pages to solve that one thing that you need right then. That's what I love about the entrepreneurial library. So the hope is, again, we can keep growing it year after year and just kind of adding to it little by little.
And now with
Um,
AI, you don't even have to read the whole 200 pages. You can literally
no, just give me the summary, right?
do question, like you can question the book as if you're questioning the author.
Yeah. Yeah.
I think was it Talk to Books or something? I'd have to remember. But someone had mentioned that I've been really getting deep into AI in the last year. And somebody had mentioned that, like, you can literally load up an ebook and just question it as if it's now the author is like your
Yeah.
business coach. It's pretty amazing. Yeah.
God, we live in an amazing time right now.
I'm creating a Dr. Jarod Carter AI chatbot right now. So I'm loading it with all my books,
Yeah.
blogs, podcasts,
That's
transcriptions,
awesome.
trainings, and we're teaching it. We're teaching
Yeah.
it, but pretty soon my coaching program, it'll be a value added thing. It's like, hey, if it's 10:30 at night and you're working on an email and you can't ask me in the moment, well, you can you can ask me
Right.
to write the email for you,
Yeah.
and it will. It's
That's
crazy.
awesome.
Yeah.
All right. I want to throw it over to Tan, let him take over and open it up to the questions. Tan, how about it, man? Jarod, thanks for
All
everything, man. I
right.
appreciate it.
You,
So,
Scott.
Dr. Field, thank you for being here.
Yeah.
As you mentioned before, about that question that you said that we were definitely going to loop over back for, is how do you know when you're ready? How
Yeah.
do you know?
So, when I'm doing things like this with PT students, and I just want to say I absolutely love that you guys have an interest group that, a group of students that in the midst of the chaos that you're already looking into this stuff and taking the time in an evening to do this. I'm just super impressed. And you're a small, percentage of as of most of your colleagues. And there'll be plenty that get interested after they get out, but they're like, oh, I can't even imagine. But you guys are imagining, you're doing it. So I mean, you're showing the characteristics of someone who's going to be ready a lot earlier than others, right? When I usually am asked this question, it's not often how do you know when you're ready? It's, can I do this straight out of school? There's a lot that want to do it straight out of PT school. So I'd like to kind of try to speak to both of those things. Um, Maybe the second one first. When it comes to, can I do this out of school? There are examples of cash-based practice owners who started straight out of PT school, and they are successful by a lot of definitions. I mean, maybe they have a small practice with a fairly booked schedule, and they were able to get there within that first year out of school, and things are going great. And I think they're often kind of put on a pedestal, not that they shouldn't be, but I just want to kind of point out that if we really step back and just say, look, if I'm in this, and most, I keep going back to, most of us are in this because we want to help people. At least that's one of the primary drivers, right? And we want to help people at the highest level. And what I can say is that even though you guys are going through the University of St. Augustine, which, of course I'm biased, but I really think it's one of the best programs you can possibly come out of. And you're going to come out really strong as a physical therapist new grad compared to others, but you will be a tiny shadow of what you will be 1 to 2 years later. Like, it is amazing, especially if you actively seek out your initial employment under, with some mentorship and things that they're going to, do along the way, with you, and just being around colleagues and being able to discuss cases and ask when you're not quite sure about things. I mean, the value in that and what it will do for your ability. Okay, thanks, buddy. Thanks, Scott. Appreciate it. Um, your ability to help people and to live out your mission to help people at the highest level is going to skyrocket right after PT school. And there's just so much value in that, that even if you could, I mean, you could take the scripts that I give, my students, and you can get people to say yes to cash pay therapy. If you follow the right guidance, the right business guidance and sales guidance, like, you can get them to say yes. But on the back end of that, you're going to get some people better, but there's going to be plenty of people that you don't get nearly as better as if you had, taken a mentorship or a mentor kind of, scenario, even if you weren't making as much as you'd like to. But to learn from someone who's really going to, or a group of people that are really going to take you under their wing and guide you, in the long run, you're going to be able to help people at such a higher level that it's going to support your business, your long-term practice at such a higher level. If you think about, let's say you're getting people better at this level, if you go straight, if you skip the mentorship and you go straight into practice, right? But you take a year or two and all of a sudden you're up here. Over time, that difference in your Google reviews and your word of mouth and the physicians and other professionals that, hear back from those patients they sent your way, that is going to trump having started 2 years earlier. Long term, if you're playing the long game, I personally really suggest, unless you're like some badass massage therapist from, in your past career, now you did PT school and you already are just incredible with your hands. And we're talking manual therapy, right? Not all, I mean, there are plenty of amazing therapists and cash pay practices that where they barely touch their patients, right? It's more exercise based, or it's neuro, pediatrics, whatever the case may be. But I'm just saying, like, it long term, if you can take a year or two and really, really focus on just getting really, really good, and you can continue to consume this kind of content, there's tons of it out there. I mean, I was the first one coaching on this back at, starting like 2011, but there's obviously a ton of content out there, and programs you can get into, whether paid or free, and you can consume that while and get ready, right? Build up your business skill sets while you're also building your therapy skill sets. That is, I think, the best approach forward. Now, if you're dead set on doing it straight out of the gate, you can. But I think long term, you won't have as solid of a practice, most likely, especially if you stay solo or are really small. If you're like, you know what, I'm gonna I'm gonna hire amazing therapists and kind of pull back and mostly just run the business, and not see a lot of patients, and that won't be as much of a factor. So there's a lot of things to kind of consider there, but in general, I think for most people in most cases, it makes sense to find a great initial mentorship in your first employment and get really good. Do that for 1 to 3 years, maybe more, and build up your business knowledge along the way. And then you're ready to, like, really, really make a splash and have a successful practice that really serves people at the highest level. So how do you know when you're ready? Now we talked about, should I do it right out of school or can I? How do you know when you're ready? So yeah, I think that from a skill set perspective, you need to be getting, like, the vast majority of patients on your schedule, you need to be getting really solid outcomes for. Like, nobody can fix everybody. I can tell you that much. But you should be able to get 90% of your patients, totally better, unless you're like in a chronic pain niche or something where, 100% better isn't really like a valid goal. But if the majority of your patients that are coming through, like, they have a 100% better, endpoint that's possible, you should be getting 90+% of them there. If you can keep them on schedule, a lot of them will drop off schedule, and that's a different topic, right? But those that stay on schedule and keep working with you, like, if you're not getting that many, that high percentage, really, really, really good. And then the other 10% that you can't necessarily help to get to 100%, you should know who to point them to, how to help them out. I mean, maybe there's mental and psychological components to it. I mean, you can still help them to a high degree, even if you can't rid them of their pain or limitations. You can still help. And that's the kind of stuff that you learn just with reps and with colleagues surrounding you and mentorships and discussing cases. And so when you're there, like from a clinical perspective, then I think you're ready there. And then along the way, I mean, there's not like a, you know, a rating scale of like business prowess. And a lot of times people, they kind of open their doors and start seeing patients, and then they try to figure that part out. And that can be a struggle, right? I mean, if you are a total clinical badass, then that can really help, because word of mouth alone with the results you're getting can really fill your schedule quite quickly. But again, there's so much cash pay competition now that it goes beyond just getting good results or spending 1 hour, an hour with every patient. You really have to compete from a business perspective to generate sufficient leads to fill your practice schedule, your schedule, and then subsequently your future clinician schedules. So I think that I would suggest doing some sort of preparatory programs, private practice programs specific to cash pay, if that's the direction you want to go. uh, and coaching. I mean, I've had a lot of students that started working with me like a full year before they actually open doors. Not a lot, not many will take that long of a runway, or like have the foresight to do so. But I'll tell you what, they were ready to make a splash. Their schedule was half full on week 2 because they were able to put all of these marketing systems in place and really get people ready to say yes, and get their referral sources ready, and get their ads and website and all that. Like when you have that kind of runway, and let's say you decide, I'm going to take Jared's advice, I'm going to work for 2 to 3 years under a great mentor, and then on the back end be preparing those things, and you can do that. You can get all those things in place as you go, and really be able to get a full schedule quite quickly when you do open doors. So I can't say any definitive like this is exactly when you're ready, but those are the things I would say you want to do to get there. And don't you guys are already again showing these characteristics of like pre-planning and working on this ahead of time. So I don't think it's going to be long after you're out of school that you probably have the basic skill sets of lead generation and sales conversations. If you were to go through some programs and some coaching, like you'd be there quite quickly.
All right, amazing. And in case of any guest here, if you want to ask any questions, please go ahead too. You could also start messaging in
Yeah,
the
so
chat.
quick question.
Yes,
Thank
go
you,
for it.
Tan. And I put in the chat too. I'm just not sure. I'm in a loud environment right now. But Jared, thank you for being here. And then quick question. I know you've worked with a ton of business or practice owners. How rare is it for someone, and is it feasible to kind of open up shop right out of school?
Yeah, and so I know you'd mentioned you're in a loud
I know
space.
I'm in a gym right now. I'm sorry.
Yeah, so you probably missed it. I went fully into that exact question. So
I'll watch the recording.
yeah, I would go back to the recording to get all the details. Um, I have helped a few to start right out of school, but I don't really recommend it for the reasons I'd mentioned before, of just long term being able to not just serve your clients but your business by having a more solid clinical foundation and being able to just get better results over time. The people that are coming straight out of school, I don't care. I mean, I was in my class, I was the valedictorian and got the MTC 6 months later. And I came out, as a pretty solid new grad. Um, but again, I was nothing compared to how good I was just 1 year later. And I had actually my first employer and mentor is a USA professor for craniofacial, Mark Strickland. And we were, this is 20 years ago, or about almost 20 years ago. I was texting with him this morning. Like, that's how valuable a good mentorship and relationship like that can be. He still helps me out. I still lean on him for recommendations. There's just so much value in that. And I think that you're going to be able to serve your business and your patients, both with better results, if you do that first out of school. Jose, yes, of course you can. There's plenty of examples of that, and I and others can help you to do that, but it's just not, I think, the most ideal path forward, but it's possible.
All right, thank you.
Yeah.
So another thing is, how did you find your niche in the market? How did you carve it out? When did you notice that it was there, that it was just right for the taking?
So defining your niche is certainly important, to a degree. I mean, it's not like I'm in my practice, like I'm an ankle sprain guy, or I work with soccer players, or I'm big in the running niche. We did have a running sub niche, but my practice has always been, we treat head to toe outpatient orthopedics with a strong emphasis on manual therapy, and tend to get pretty fast results. But that's not really a niche. That's more of just, I mean, if you could say like manual therapy is kind of like your treatment approach niche, but a niche really comes in handy as when you want to quickly grow, or quickly, fill your, at least your schedule, right? It just, the more niche down you are, as long as there's a sufficient number of people in that niche that you can market to, the more honed in your marketing message can be. When you're trying to write blog posts or emails or ads for the generally active gym goer population, versus you're trying to write ads for brand new moms with diastasis recti, think about the difference in your messaging and how honed in you can get in pushing the emotional buttons that it takes to get people to pick up the phone or to fill out the web form, right? So that's where niches come in so handy, is that you can get really, really defined with your marketing messages and really push emotional buttons with everything you do, because it's focused directly on that person and you know them inside and out, their motivations, their fears, their everything in between. The more broad you get, the harder it is for any given piece of content or marketing to do that for the people that are going to see it. Does that make sense? So it is important in that way, but it's not 100% necessary. Like if you don't want to say, you know what, I'm going to hone it and just be like the shoulder person, in my area, or the Pilates PT in my area. Like, you don't have to do that, but it can help to make things move faster, especially early on when you're trying to get established. So I can say that I've helped a lot of people to define their niches and know how to go after them, but my own practice is not super niche down. Actually, it's more of like the general active adult population in Austin, Texas. Maybe slightly higher net worth, but really more of a mindset of, I'm willing to pay more out of pocket if I can get a higher level service and a faster, better result. That's kind of if I were to define my niche in a few sentences. So with that said, can you repeat the question and give me some more context or specifics on what exactly you want to know, like how to figure out who to go after, or once you've figured that out, the best ways to go after them. What exactly else do you want to know about, like, kind of the niche definition and
I guess it would be that, like, how would you find your own group, just so you don't get like priced out or pushed out of your own market as well?
how would you find your own niche
Yep.
so that you don't get priced or pushed out of your market? What do you mean by
Yeah,
that?
like how would you define, like, say you've been practicing for quite some time and you're just trying to find out, like, you want to go alone, go at it yourself, and how would you find your niche? Because apparently there's like someone for everyone now. There's a PT, like we just talked the last semester too, a PT that only works with jujitsu athletes,
Mhm.
and we've also talked to PTs that only work for biking. So
So
how
can I
how
hop
does
For
in?
what?
find that?
What was the second one?
Just for biking,
For
just a
biking,
cycling
yeah.
PT. Yeah, like
Yeah. Yeah,
Could
and of
I
course,
hop in on this
you're
one,
always
guys?
going to get like the spouse of that jujitsu fighter or the kids, or you'll get that, but you can really focus your marketing just on your niche and know that that'll be enough to keep you busy. And I think when it comes down to finding your niche or choosing your niche, it's kind of like choosing your career. It needs to be something that you're passionate about. You're going to be happy to get out of bed and work with that type of person, and that their goals are similar to your goals, and it's going to be really fulfilling to help them out. For some people, helping the geriatric population is so fulfilling, and wonderful to keep those folks moving into later years and just living the lifestyles, and really helping their health span equate to their lifespan, and not having a terrible last decade, right? Like that's super fulfilling. For other people, that's like show me the door and find me another career, right? And vice versa. For some people, it's like working with high school athletes is just such a joy, and for others, it's like I can't stand dealing with these you know little whippersnappers and their parents, that think that they're going to all become the next Tom Brady, like that. So it really is, what do you love to treat and who do you love to work with, right? And then once you kind of define that, you do have to check the other boxes, like one that I mentioned earlier is there a sufficient number of these folks in the area, right? Who else is competing for that niche, right? And um, now some niches will still have, in a larger city, will still have thousands of people available, and it's okay if there's multiple competitors, because you got to say, like, if I carve out a 10% slice of that pie, is that going to be sufficient to fill the schedule of a practice the size that I want to ultimately create? And with the right tactics, you can outcompete even those that have been in a niche for a while. You really can. So look at the size of the population of the niche you're going after. Make sure that there's enough of a pie for you and additionals to add in. Like if it's already like, ooh, it's going to be tough, it's going to be, fighting for scraps. 500 people in our area that does this thing and already 4 people going after it, and don't expect that you'll never have more that kind of come in and start to chew away and try to take their slice of the pie as well. So those are the things that you kind of need to analyze first. What are you passionate about? You can be excited to work with that type of person in that activity or whatever it is, for years to come, that you can easily attract other therapists. It's not going to be such an obscure niche that it's going to be like difficult to find staff, when some cases it's hard to find staff in the first place. And then when you're in some like super tight niche, it's like, oh gosh, I love treating TMJ, but man, I cannot find anyone else who's interested in it in my city. Like I can't scale, right? I have a few practice owners right now that are like in one of them's in the pelvic health niche, which is an awesome one to be in because it's generally underserved. The insurance-based practices are usually on a long wait, like it's a month or two to get in. And it's there's a lot of emotion behind it. It's a great niche to be in for cash pay. But part of why it's underserved is there's not enough people that specialize in it. So when you're trying to scale in that kind of niche, it can be, it can really, staffing can be a big ongoing long-term problem. So those are things to consider as well. But predominantly, what are you going to love working with? Is there enough people in your area, and minimal enough competition where you can get a sufficient slice of that pie?
All right, that was amazing. So,
Jared.
Jeremy, I hope that kind of answered your question. Let me know if it did or didn't. And we are also open to the floor if anyone else wants to ask anything.
Yeah, so I want to kind of piggyback off of that conversation. So to answer to you, right? So for me personally, I love basketball. I grew up playing basketball. I'm lucky enough to work with basketball athletes at the high school level. So I feel like, getting those experiences will help you kind of drive you into your niche. But Jared, I also reside in Austin, Texas.
Mhm.
So being in Austin, Texas, I've been exposed to a lot of other communities, right? Like the bouldering community,
Mhm.
the swimming community, So you mentioned directing your ads to the population directly to diastasis recti, right? So I'm thinking I want to market myself to the basketball athlete, to the recreational rock climber,
Mhm.
and to the recreational triathlete, predominantly maybe the swimmer. Is that almost spreading myself too thin and like watering down the message if I make three different ads for those communities?
No, no, like it depends on the form of marketing you're taking. We're doing right now, rolling out we're doing it in the middle of a marketing and lead generation course. And
Mhm.
that was something that came up early on. It's like, because we were defining our ideal patients, you got to know inside and out the people that you're targeting. And like you, plenty of people were like, well, this is, the predominant thing, but I also really like working with this type of person or in
Right.
this, this sport. And you can absolutely have more than one niche. It's just a matter of there are different forms of marketing that will lend themselves to being able to stay really nice and targeted to that niche. And then there's other things like, say, your website homepage, where it's a lot harder to do that, right? So if you're trying to have a website homepage and you have these really defined, you're like strong niches of swimmers, rock climbers, and basketball athletes, that's a little bit hard to represent properly on a web on a homepage where everyone that hits that in those three are going to feel like you're really like their guy, right? Whereas take your advertising example, you can absolutely get super targeted with your campaign to high school basketball athletes, and actually you're targeting the parents, the decision makers with that. But you can do a campaign for them. You can do campaigns for every niche that you have. Like I love paid advertising for that reason, because you can get so targeted. As you're moving forward, Jose, make sure that you are really being good about segmenting your email list, all your clients, that you have them categorized or tagged as, this is a basketball player, this is a swimmer, this is a rock climber, this is none of those things, right? But really having a segmented list so that when you have a promotion that you're going to be doing that you want to get as many yeses to, well, maybe it's the same promotion, the same basic like offer, 25% off, this back to school package of 5 visits, right? But you create an email campaign that's specific to your basketball players, that's specific to your rock climbers, that's specific, like where you can get targeted in different forms of marketing, you should. But some forms are just it's harder to do so. Some areas of your business, it's harder to do so, but you can absolutely have multiple niches over time. I would suggest choosing one first and start with that. Make your inroads, get enough patient flow to pay the bills and make you happy, and then add in niches as you go. I wouldn't try to start with all three at the same time and doing marketing campaigns to each of them.
No, that was perfect advice. Thank you, Jared.
Yeah,
Definitely a lot to consider with that.
absolutely. So Jeremy, in the chat, you had said, would you recommend doing a residency to get an extra level of mentorship and getting specialization before opening up private practice? Yeah, I would. You don't necessarily have to do like a full-on residency and, you know, take on more debt if you have to do that. But I would say just making an effort to find an initial employment where the practice owner is obviously not just telling you they do this, but like you can see that they really have great mentorship culture within, with their other staff. So finding that that's what I found coming out of school with Mark Strickland. And it was interesting because half of my patients right out of PT school on a weekly basis were TMJ patients, but I got all the other half were general ortho head to toe. So I got great experience there. And I would just really strongly suggest anything like that, whether it's through a residency or just a great employment opportunity. CJ said, is it feasible to have a 50-50 split clinic with half cash based and half insurance payers? Is there ethical considerations with this format? Absolutely. Yeah. I mean, I've had lots of students that were 50-50, 80-20, 10-90, like everything in between. The hybrid model is it really comes down to if 50% of the payers that you can be in network with are paying you awesome, or at least pretty good, then great, be in network with 50% of them. If none of them in your market are willing to pay, where pay enough where you are making a solid profit that you'd be happy as a doctoral level business owner, with everything you put into it, are you happy with $10 an hour, right? Probably not. So that's a scenario where, and if you weren't on earlier, you can go back. I would listen from the beginning because I talk about the math there and how I'm known as like the cash pay, the cash pay practice coach guy. But I'm not necessarily like, hey, everyone should be 100% cash pay. It totally depends on the math, and it also depends on the administrative burden and headache that even a good financial payer uh, imposes on you in your practice, right? So go back and listen to the beginning there. And yeah, it just depends on your market and how much you want to be making. And just know that generally payers are moving in the direction of paying you less and less over time. And I can guarantee you that your overhead costs as well as inflation are only going to get worse. So just know what's on the horizon if you do, get in network with anybody.
Gotcha. Thank you.
You're welcome.
All right. So to respect your time, I would like to ask for any final word before we wrap up because it's almost going to be an hour on the dot. So if anyone has any
Yeah,
really
Jared,
burning
one last
questions, please go.
Any last questions? Yeah.
Yeah, I
Yep.
got one. I'm sorry, Tan, to cut you off there, but I know you touched
Absolutely.
on it earlier, Jared, when you were like talking about, do your market research, let's not accept these lowball offers on insurance, whatever contracts. And I hope this isn't a silly question, but how do I go about like doing this market research? Where can I investigate what this place pays compared to this place? And does that change county to county, state to state? Like, are there some websites, resources?
Good question. And since I'm not really in the realm of like getting people to go into the insurance world, I don't necessarily have resources or like, hey, it's all on this website because that's actually private information. It's between the payers and each individual practice. And in one city in the same market, you can have a small private practice with, 2 or 3 providers. And two doors down, you can have a practice or a clinic that's a part of a huge conglomerate. And the small practice is getting $65 an hour, and the big practice, because they have the negotiating power, they're getting 95. I mean, like a full, 50% more, literally. So that can really, really range widely, and it's not publicly available information. And
That makes
so
sense.
what I would suggest is that you do your networking, you get involved with the other private practice owners in your area, and ask the questions. I mean, if there those groups aren't already meeting, start one. you know but I think networking and going to, not, I mean, here you're in this special interest group for students who want to go into practice. There's the PPS and there's other groups like that you can get involved in to gather that information directly from the practice owners. Because just calling them cold, is, you're probably not going to get that information, and I don't believe it's available freely online. The other part of it too would be just reaching out to the insurance payers and saying, hey, I'm looking at starting a practice and wondering if you're accepting any new PT practices on your panel in this area. Because that's another thing too that we're finding. This has been going on for a while. There are plenty of markets where Blue Cross or whoever it is, they're like, sorry, we're not taking any more PT practices. Like, you're literally forced to be out of network with them, even if you were willing to take their crappy reimbursement. So if they're taking new folks, you can kind of start the process with them and start the negotiations, and you'll pretty quickly know, okay, well, they're paying this much per code of manual therapy and Therex, and this is about what I'd probably be doing. I'll probably do 2 manuals and a Therex and a neuro re-ed for most hour-long visits, and that's going to equate to about this much. Or they're a capitated rate, and they're like, look, in PT for PT in your area, we pay $55 a patient, no matter what you do with them. So just starting the process with the different payers that you're interested in taking, because a lot of people in the area have them, that'll also get you the information. So it's going to be a little bit of groundwork. It's going to take some time,
Yeah,
but
no,
you
that
can.
totally makes sense. That's why I've always been like unaware of what these numbers are. That because
Mhm.
it's a very private thing. You mentioned the bigger conglomerate having that negotiation power.
Yeah.
Does that come down to like just the legal team or
Um, no, so there's something that I've kind of named, and I'll try to summarize it quickly, but I call it the reliance leverage cycle. And so what that is at the top, you have large conglomerate, huge healthcare systems, often hospital systems. In the middle, you have the insurance payers, and then in the bottom, you have smaller private practices. And the way it works is the really large hospital systems, let's say you're even in a decent sized town, like if you're the primary hospital in that area, or you're one of, right? And a lot of people in that area are going to rely on that hospital system, which now it's not just the hospital, it's all the private practices that they've bought up, right? So if all of those insureds, those people that are going to be paying for insurance, are reliant on an insurance being in net or having in network that main hospital system and all the private practices, that system has leverage over the insurance company. Because if that insurance company doesn't play ball and pay them what they want to be paid for their services, then they're like, fine, we'll just be in network with United and Blue Cross. Screw you, Aetna. And now thousands of people in that market are not gonna take Aetna, are not gonna pay their premiums. They're gonna go to Blue Cross or whatever, so that their child can be seen at the children's hospital, right? And so that that they can go to their primary care. So they have leverage because of the size, and they can dictate and say, this is what we want to be paid for these services, and so they have that negotiation power. So don't worry, the insurance companies are always going to get their profits. So guess where they get them? They get them from increasing premiums on their actual insureds, right? Us, not us as practice owners, but just, people with health insurance, and increasing deductibles, right? We've seen that. So copays, deductibles have skyrocketed, premiums have skyrocketed. So they're passing those losses from their where they are the small dog. They pass that on to the actual, insureds, and they also stick it to the small practices, because you can't say, if you don't, play ball with me, I won't be in network with you, and then no one's going to want to carry Blue Cross in our area, right? You're like two clinics or one or whatever. Like it's only when you have like dozens and dozens of clinics that you start to, it's not like you get 5 clinic spaces and all of a sudden you're going to have that negotiation power, by the way. No, you've got to be a big, big player to be able to say, look, you're going to pay me what I'm worth or what we're worth, or we're not going to be in network with you. It's got to be representative of them losing a lot of people potentially off of their, and in like with PT alone, even if you had 50 clinics, they're like, okay, it's not like people are going to move from Aetna to Blue Cross just because they can't go to the PT place, but they will if it's the hospital and their pediatrician and all the other physician groups that the hospital has acquired in the last 5 to 10 years. And that's what's happening. So what we're going to see over time is that there's going to be basically two types of practices. There's going to be practices that are owned and run by huge conglomerates, and there's going to be small, mostly cash-based practices or fully cash-based practices. All the stuff in the middle is either going to be sold to either go out of business, which most people won't allow that to happen. They're either going to go out of business, or they're going to sell to the large conglomerate, right? Often continue to work for that business that they work so hard to create, and now they're getting all this pressure, and you got to see more patients and blah blah blah. Or they're going to transition out of network if they didn't start cash pay in the beginning. That's what we're going to see long term, is huge conglomerates, small cash practices, not a lot in between. So that's the story of why you've got your huge conglomerates have the negotiation power over the insurance companies. which have the negotiation power and the leverage over the small practice owner.
Man, you called that the reliance leverage cycle?
Yeah.
That was a very thorough explanation. Thank
I
you.
like to name things.
Yeah. You're good at it.
Yeah. I'm trying to think of if you guys really, where do we have this housed? I have a webinar that we run regularly, but I think the only way I'm trying to think of where people sign up for it. We have Facebook ads that run to it, and then anytime anyone is at my website, drjarodcarter.com, we have a lot of lead magnets there, basically, with their free, their free resources. Like if you go in, let's say if you type in right now, drjarodcarter.com, let me just bring one up, drjarodcarter.com, and then you put a / and you put any number up to, like, at the time of this recording, I think 36 or 37. You're going to go to a video training that'll have a free resource associated with it. If you want that free resource and you download it, after you download it, it's going to redirect you to some sort of offer. And the first thing you'll usually see is that webinar I'm talking about. So if y'all wanted to check out that webinar, learn not just about the reliance leverage cycle, but basically the webinar is how to add 2 to 5 cash pay patients to your schedule every week reliably. And we're talking, you can be an insurance-based practice, but if you want to add more cash pay patients, or you can be a cash pay practice and you want to add more cash pay patients, but that's what it's about. Regardless of the type of practice you have, it's how do you create the VOP care experience I talked about before, learn how to sell them on the value of it before they've actually experienced it, get the phone ringing off the hook, and then scale it up, automate it, systematize it, and staff it. So if you want to learn that, just go to any of those, download a free resource, and then keep an eye out for the webinar sign up. And I'll see you. I do those live very frequently.
Thank you. I'll definitely check that out.
Thank you very much, Dr. Jarod Carter. And this is going to be a plug for BEPP. I think we will have a future guest that will be talking about insurance and negotiating the amount of pay you have with the insurance company as well. But volume speaks the numbers, really, at the end of the day. But thank you, Dr. Jarod Carter. Any final words?
I just say thank you all again, because, and I'm just, as I mentioned at the very beginning, I'm just so impressed that in the midst of the chaos that is, what I remember going through University of St. Augustine, and I'm sure most programs, that y'all are really looking into this, taking time in the evening to do it. I'm just super impressed. And yeah, I mean, go to drjarodcarter.com. There's so much free content there. And get on the email list. You'll stay abreast of, we put out, new content all the time. It's not just like course after course, but it's regular, video trainings and podcasts and all that. So, you guys can learn on the go, listen in on that stuff. And when you're ready to pull the trigger, you'll be well educated. And, at that time, then hit me up for real coaching, because that'll really accelerate things, right? It really makes a difference when you can ask a question like now in real time. Hey, such and such gym owner just said I can come over and do a talk. What should I do? Right? Okay, do this, and that. Like, screw trying to listen to 15 podcasts to get that answer. Just get the answer right then. It's worth it. So get coaching when it's time. Yeah.
All right,
guys.
And please follow Jarod Carter on Instagram, Facebook, and his podcast.
All right. Yeah, appreciate y'all. Keep kicking butt, and I'll see you on the inside of my trainings and stuff soon, I'm sure. But right now, get through school, become a great therapist, learn what you can business-wise along the way, and I'll be ready for you when you're ready.
All right. Appreciate that greatly. And thank you for your time today.
Thank you all. All right. Take care.